Hi, Mrs. Thanks for joining. You're the first one. Hi. Okay, let's see. Nice. So you're a registered dietitian from North Carolina or North California, right? Okay. Happy to have you here. Yulasha joined. Hi. IBS FODMAP nutritionist. Antonella joined. Hi, everybody. Let's see if I can get Dr. Laster on. Boutique Girl, hi. So tonight is the last night of our Feed God series. So I already feel sort of like sad. It was an amazing experience. So after this, stay around. Vanny and Christina, they're going to come on for a session. It's going to be a live culinary experience. It's going to be fun. Hi, it's West Functional Training. Thanks for joining. I've got some difficulty getting Dr. Laster on. Okay, doke. Let's see. I may need to log off and log back in. Hi, Narella. How are you? Hi, Mirelli. I think Janice has a problem to join. Okay,
Hi,
hello.
how are you?
Good. How are you doing?
Living the dream. Busy work day, but survived.
Oh my God, you look so good.
This is my excuse to get my life in order and to not be all crappy like I am for the rest of the day. Uh-oh, am I going out there? Let's
Uh,
see. What do we have going on? Whoopsies. Maybe. There we go. Cool.
okay. No, you look great, all glammed
Thank
up. Okay, I
you.
love it.
Had an excuse to put on some lipstick. I'm like, thank you for that. I don't have to look all crappy, like typical.
I know. I just like it's crazy when you think how our life changed.
I
So I
know.
haven't really worn lipstick except when I'm at home or now we wear lipstick. We dress
No,
up when we're at home.
exactly. It's really sad. At work, it is like, a mask, another mask, my glasses, my goggles, a face shield, a thing, a hairnet. You just look like a crazy person.
Exactly, right? It's just like, so today I was thinking, you may have this experience too. I started my current job during pandemic in October.
Oh, wow.
And so whoever I see at work, I see everybody is masked up. So I'm thinking if I see these people, my staff outside, I'm not going to
Won't have a
recognize.
clue. Will not
Say,
have a
who are
clue.
you?
And it's funny, they've started like sending, sometimes the patients have never seen you before, like a little thing in the mail so you could see, like, okay, this is what your doctor looks like. You won't ever see them like full face. So they're like, oh yeah, I remember you from the picture, from here up, So that's actually one thing I like about telehealth appointments because I can actually see people. So that part is nice.
Mm,
So my patients that I've never met before, it's really nice when I get to see them out the office. They're at home. I'm like, oh, that's the rest of
that's,
you.
I know, right? So it's crazy. Sometimes I think how we are going to just go back to normal. I don't know if
Yeah,
at any point we are going to go back there or it's going to be sort of like a new normal that
yeah,
that's just like who knows, right?
yeah.
We live day by day.
I know. We
Yes,
keep our fingers crossed and we just, try to make it. That's all we could do at this point.
exactly. So, but we have just 12 people here, so
Hi guys.
yes, very excited to have you on. So tonight we are actually wrapping up Fit Gut series, and
Awesome.
I'm so thrilled to have you here. It's a very important topic, and it's right
Yes.
up your alley.
I love it.
I know. Just to just to announce that after this session, Vani and Christina, they're going to hop on for an exciting session. They're going to have a live culinary experience.
Ooh,
Yeah.
awesome.
Yes, it's so everybody just stay tuned after this. We're going to have a different session. And yeah, I can't wait just to see what they have
Right,
prepared
cook
for
up.
us. I know, right? Very good.
Awesome.
Okay. So just was going to introduce you briefly. Again, I'm very happy you're here. So Dr. Janice Laster is a gastroenterologist focused in nutrition, obesity medicine, and bariatric endoscopy.
Yes.
So you completed both your internal medicine residency and GI fellowship in Georgetown University Hospital in
Yep.
DC, where you live right now, right?
Yep. Yep.
Yes, and you actually started a new venture recently and opened your own practice.
Yeah.
Very exciting. So I can't wait to hear about that. So I'm going to ask you a few questions about your
Sure.
practice and what you do. So your new practice is actually has this sophisticated name, Gut Theory Total Digestive Care. I love it.
Thank you.
And you're focused on evidence-based nutrition, pharmacologic therapy for obesity, and also
Mhm.
innovative endoscopic treatment
Yep.
for weight loss.
Yes.
Yes, all exciting stuff.
Yay.
Yeah, I'm sure our audience, they cannot wait for you to share your experience. So I want Janice to start with what you're doing right now. Just tell us more about what you do in gut theory. How did you get here? You know, you're a GI doctor.
Mhm.
So traditionally, GI doctors were not doing obesity medicine. There has been some change that there is a trend that some GIs, they develop an interest in weight loss and obesity medicine, which is great.
Mhm.
So I want to know your story. How did you end up just picking this niche?
Let's see. It started back, now that I think back to it, and after I kind of thought about it a little bit more, I realized it sort of started kind of throughout my childhood. I have to give my parents credit. They're not on Instagram or Facebook, so they won't ever see this. So it's great. But they, I was they always, had healthy foods around. They always had a garden growing up. There was never sodas in our house. I knew if, we were having guests, if sodas popped up in the refrigerator, I'm like, who's coming over? I was fooled into thinking like, grapes were dessert and yogurt. And so these are things that I just kind of grew up with. And so I was annoyed when I went on field trips and I didn't have a Lunchable like the rest of my friends. I'm like, I want a Lunchable. Like, what is wrong with you people? Why can't you just be normal? And not, I called them hippies. And why can't you just be normal? And so fast forward to residency, the big article came out about bariatric surgery and how, that should be something that we should consider in our patients that are affected by overweight and obesity, and to help these patients with metabolic syndrome. And so it was kind of a big discussion among our residency program, and it kind of like sparked a bunch of, hot
Hmm.
topic sort of thing. And then fast forward to GI fellowship, I just started to see so many patients with the exact same problems over and over and over again. Everybody had abdominal pain, bloating,
Hmm.
nausea, vomiting, constipation, diarrhea, and then the fatty liver that kind of progressed into cirrhosis. On top of the kind of metabolic syndrome, we saw everybody with the high blood pressure, diabetes. And it got to the point where it was just routine and you didn't even think about it. You just wrote patient with hypertension, diabetes, it became routine, and it was like
Right.
abnormal to not see it. And I just realized you saw these people over and over. We scoped them. We kept doing upper endoscopy, colonoscopy, labs, imaging, and then we just send them on because nothing's wrong, right?
Right.
But we weren't talking about like the elephant in the room, which was the excess weight, which
Hmm.
was in the poor diet that was contributing to all their symptoms, the constipation, the bloating, etc. And also sort of their metabolic syndromes and like their heartburn, their GERD, their bloating, their fatty liver. And I realized that we weren't being taught
Hmm.
how to help these patients. And I'm like, everybody, we can't just chalk it up to, oh, she's just anxious, or, oh, this person just
Right.
has, and like, it's not like 80% of what we're seeing is this is what
Hmm.
we're seeing. It's like, what are we going to do about
Right.
this? And then we just kept seeing sort of the obesity rates go up, the metabolic syndrome rates go up. Georgetown's a transplant center. And so we started to see that we were transplanting more patients that
Hmm.
had from NASH, that was, from metabolic syndrome, than cirrhosis or alcohol. I'm like, we are literally killing ourselves with food here. And so that's sort of where my interest came from. And I ended up applying for a nutrition fellowship because I realized I am never going to learn this. Like, no one here, like,
Hmm.
it's not sort of a focus of most people because people look at it as a soft science, or, they don't really, it just really started to take off over the last couple of years. And so did a nutrition fellowship and learned so much that I wish I had known during my training. I'm like,
Right.
well, I wasn't really helping a lot of people so well. And then decided that because I am a proceduralist, I want to be able to incorporate. I think you should be able to offer patients and meet patients where they are and offer them anything you can to help them, right? And so I'm not a surgeon, but I decided I am an endoscopist. So if there's options out there to treat these patients, why shouldn't I learn it? So
Hmm.
then did the bariatric endoscopy fellowship as well, and wanted to learn more about kind of obesity medicine aside from nutrition, and did sort of get my obesity board certification as well. And I just knew I had to find a way to put it all together, because patients, I mean, almost there's studies that show by, in the next 10 years, over half of our population is going to be diagnosed with overweight or obesity, and we know that increases mortality risk. We know that increases cerebral vascular disease and cardiovascular disease. And the common denominator is sort of our diets in the U.S. When the world was open and we traveled around, you could see that when you traveled, the
Right.
differences in sort of our diets and portion sizes, and the taste of food even being fresher and different, and eat certain things that weren't even allowed in other populations in their foods that we allow in our foods here in the U.S. So
Mm.
it was me wanting to, and also being sort of sick of seeing sort of all of these gurus online that were putting up sort of like, fake news in a sense of, all of these fad diets that people were hopping onto, and just would cringe. I'm like, your microbiome is like dying right now by eating like three. I'm like, what are you eating? Stop. So, oh, I love that cup. That is so
I
cute.
know my poop cup.
Oh, we're such GI.
I know we are such
Only
nerds.
people that will drink things out of poop. But
I
I
know.
love it. So yeah, I decided that, we needed to make this more mainstream, and then decided, okay, they should be on, started being on social media more and seeing, oh, there's my tribe. They're out here. There's more people like that are, kind of feeling the same way and learning from each other. So that's sort of my story and kind of how I got here, and just recognizing that it wasn't going, being in a traditional medical setting, they were like, oh yeah, that's
Mm.
cute. Yeah, you could do that, but that's like your little side project, like we need you to do 20 colonoscopies today instead. And so that's sort of where my practice came from, is just knowing that I didn't really fit very well into a private practice model or
Mhm.
really an academic model. So I keep my foot in the door a little bit. I'm affiliated with GW. I do some work at Eastern Maine, to help out because they're an underserved area. So I keep my foot in little sort of the academic door and do some research, but then I get to keep kind of my baby and my patients and sort of help with like those procedures and such. So that's my
Awesome.
crazy story.
No, I love it. So, I cannot agree more, Janice. It's just like you brought up that elephant in the room, right?
Yeah.
I think exactly nothing can really explain the pandemic, the obesity pandemic we are dealing with, like this elephant in the room.
Yeah.
And it's mind-blowing because now, dealing with this COVID pandemic, we're just like basically all hyped up about it, and for good reasons,
Yeah.
obviously. I don't say we shouldn't at all.
Yes.
But we actually totally ignored the biggest pandemic that we have been dealing with
For
for the
years.
last, right, for years. And that's obesity that kills more people
Hmm.
than any other pandemic that we have seen in our
Yes.
lives. And we saw, I think, also another aspect of obesity. We dealt with it when COVID pandemic hit,
Hmm.
and we see how the outcomes, how
Yes.
obesity can affect and impact the
Hmm.
outcomes of COVID as a disease. And this is
Exactly.
something that I think the policy makers, us as physicians for sure, we should really change our practice. Also, policy makers here come into play. We need to come up with a solution because
Hmm.
otherwise, as you nicely brought up, I don't know, as a GI physician, so I don't really have time to deal with this
Exactly.
elephant in the room during my 15 minutes
I was gonna say with 15
visits,
minutes, you
right?
just don't have time. There's not
Right.
enough time. Like my visits are so long because there's so many other factors that play into how patients eat. Their social, kind of their social environment, where they live, how they work, where they work at night, how do they sleep, their environment. Like there's so many other factors that you have
Mm.
zero time to do in 15
Exactly.
minutes. Zero.
Right. So, that's amazing. I really appreciate what you're doing, and
Thanks.
because this takes a lot of, I know how much energy and how
Oh yeah.
much resources you have to put in place to
Yeah.
come up with this setup that you can manage really this
Yeah.
problem. Just question for you. I'm
Sure.
curious. Do you work with a team, or is it a multidisciplinary setup or
Yeah. So for now, because I do have training in obesity medicine and nutrition, so I am sort of a one-woman show. I am able to give all of the sort of guidance. There is an RD that does GI that focuses in GI in New York, who I love, who I does tele-appointments that if somebody needs a little bit more frequent follow-up than mine, then I'll send to her. But typically, like for now, it's kind of all me. And then in the future, I plan to have, and I really need to find a good GI psychologist because a lot of the mind gut connection is 100%. So I was so glad when you guys did that night as well because there's such a connection there. But I think for a typical gastroenterologist that not obesity medicine trained or not trained in nutrition, they would need sort of a specific GI nutritionist because they're not all kind of created equally. And there's some awesome GI RDs out there, and definitely somebody who's well versed in obesity medicine. So knowing those weight positive drugs, knowing how to switch transition those things, and knowing how kind of anti obesity medicines work and like the contraindications to other meds and that sort of thing. So I
Mhm.
am crazy enough to have done, all of that training, so I'm able to
Right.
do it. So, but yeah, it's really important, and there's so many little pieces to each part of it. So,
Right. So,
yeah,
it's just like impressive. I think so you're the right person. So just so you have all these sort of like skills from nutrition to GI and also the
yeah,
endoscopy part, and the pharmacology, what type of
yeah.
medications are out there. So very
Step by step.
yes, I'm really impressed. So
Oh,
thanks,
thanks.
yeah, thanks for sharing that with us. So, now I just want to basically ask all these questions from you
Let's
as
do
an
it.
as an expert. So, it's obesity and gut health, right? It's just something that I think we are knowing more and more
Mm-hmm.
as our knowledge about our microbiome is growing.
Mm-hmm.
So we are just finding all these missing pieces here and there. So what basically the way that I look at it is that, obesity affects our gut health and our gut health affects our obesity and our
Mm-hmm.
metabolism. So I want to ask you if you can tell our audience, how does gut health affect obesity or affects our metabolism? Let's put it
Yeah.
that way.
Yeah. So I think exactly what you just said is both the chicken and the egg, right?
Right.
So one piece of it is as we eat particular foods and we eat sort of a diet that's sort of higher in sort of processed foods, fatty foods, foods that are kind of more inflammatory, like animal-based products. When those things kind of get into our small bowel in order to sort of for they kind of break down that mucin layer. So that layer of protection that we have that protects us from that outside world, which is the foods that we eat, they're able to break through those barriers and they sort of are able to change that microbiome and those normal bacteria you have in that area. And so that's what, when people say, oh, I have so much inflammation, I don't think they really recognize what they're saying, but like in a sense, it's sort of true. But
Mhm.
you're causing this increased inflammatory process. And that's why you'll see people with elevated CRPs and that's a kind of a metabolic syndrome. People have pre-diabetes and it's insulin resistance. And so that's sort of so the kind of the metabolic syndrome piece, and patients have excess glucose, they have, and it leads to kind of excess weight that leads to kind of fat dumping in the liver, and there's fatty liver in that sense. But it also, when you have a diet that's kind of deficient in fiber, you also decrease sort of your microbiome diversity in your gut, and your gut needs this fiber for kind of small short chain fatty acids to kind of feed the colon gut. And so we
Mhm.
need those for increased gut health. And so those short chain fatty acids we know cross the blood brain barrier and help with kind of mental functioning. And so that's kind of that's sort of the kind of that portion of kind of helping with gut health is when there's decreased fiber, you decrease your microbiome, there's increased processed food and animal-based products, you're sort of increasing inflammation, increasing the risk for
Mhm.
metabolic syndrome, and thereby increase, and also changing that microbiome as well, so that you start to crave these sort of unhealthier foods as well. And the other piece of that are sort of the epigenetics and the genetics of it. And so, and they also play into sort of the microbiome as well, in which there were sort of studies that were done that showed that depending on the type of foods you eat and thereby the type of microbiome that you sort of cultivate, it kind of affects how you're able to utilize sort of the energy that you intake. So they had both these mice, they had knockout mice, and one with sort of a microbiome that was more deficient than the other, give them the same caloric intake, and that
Mhm.
lean mouse was able to kind of utilize those calories better, so they did not gain the same weight, whereas the one that was
Mhm.
the obese mouse was still gaining weight even though they were having the same intake. And so it just goes to show sort of how you're able to utilize, allows you to utilize those calories better and not to sort of dump them off and just say, I don't know what to do with this, I'm going to put it right here, and it just, that's how you kind of get fatty liver and that sort of thing. So it's pretty complex in sort of how the microbiome works and sort of how the food that you're intaking, and sort of how that changes sort of your cravings, how it interacts with your the obesity pathophysiology as well, and those gut hormones that for satiety and hunger with ghrelin and leptin. Those are all affected, and I tell patients, say, you know what, I really am craving this thing. I'm like, well, yeah, you're not wrong. That actually,
Right.
it's hormones that are coming from your brain. It's not something that you've made up, and you're not crazy. It's actually really happening. And so they kind of all play a role together with the microbiome and sort of the food you take and how it's changing that diversity and changing even sort of that genetic sort of makeup. And so over time, they're kind of, like I said, both the chicken and the egg of sort of what you're eating and how that's also affecting your already preset genes. And
Mhm.
there's studies that are coming out now to kind of show us a little bit more about sort of what genetic people's DNA and what sort of genes or snippets of genes are kind of are make people more have a higher propensity for weight gain, or those that will say, okay, this person would do better with a high protein. So FTO is one of those genes, the fat mass gene. And so it's sort of cool that these things are coming out. It's unfortunate that some of these companies are really taking advantage of it because the science isn't there yet.
Right.
So I hate to see when patients come in and they spend all this money on these tests and I'm like, that's not,
Right.
don't do that. But
Yes.
so those are sort of the sad pieces of it. But the science is cool. The microbiome is cool. I was doing some research during my fellowship about sort of microbiome differences and kind of lean versus obese patients and how that changes quickly with kind of changes in your diet. So it can change to a Mediterranean diet and how your microbiome diversity changes, and seeing kind of weight changes and that sort of thing. So that it's cool, but I try to tell patients we're not there yet. So nobody can take your stool and tell you what foods to eat at this point. So I think it'll be cool when we get there, but we're pretty far away from that at this point. So those are sort of the
Right.
chicken and the eggs of kind of obesity and gut health.
No, exactly. Yes, I think the research is amazing. So,
Yeah.
so the research that they could show that in humans and they mice.
Mm-hmm.
When they basically compared the obese or the mouse model that
Mm-hmm.
had difficulty in fat storage because of the
Yep.
type of knockout and compared it with a lean mouse, they could see that the what we know as pro-inflammatory
Mm-hmm.
microbiome or bacteria, basically, the population increased,
Yep.
and the population of the good bacteria, which is the beneficial one, actually decreased.
Yep.
And I think, as you said, we are way far from just knowing all the details. We don't even know all the combination of the microbiome, what bacteria is doing what, and what we really can make out of this. But I think it's just mind blowing when you
Mm.
think about what we know now compared to 10 years ago.
Yes, exactly. Or
Yeah.
even like when this, those sort of, some of my papers, I went back because I wanted to understand, like, how did we even get here in the first place? Like, what happened between, like, our grandparents or great grandparents that sort
Hmm.
of, ate some of the similar things, but like, back when we were in school, like, it was such a minority of patients that had excess weight, or people like in your classrooms or growing up, and where now it's kind of the opposite. And it's just really such a boom in these processed foods and emulsifiers and additives and foods that we eat. Of course, but we thought that was such a convenience when to have these things come about. Like, that was such like,
Hmm.
we were revolutionizing and we were, becoming a better and more, conservative place. And, so I think it's sort of like such a paradox to see us sort of kind of coming full circle of saying, oh, we do need to move more. Oh,
Move
we do need to
more.
have more fresh
Yeah.
foods. Oh, we do need to stop eating things that are all packaged. So it's kind of
Refined
slowly,
sugar, right?
oh, yes, all
Yes.
of the sugars that are in everything,
Corn
like
syrup.
high fructose corn syrup,
Yeah.
and that is literally everywhere. Even, people don't think, like, I get to the nitty gritty with patients and talk about even things we get down to condiments because people don't even eat. These are things you don't think about. I'm like, this is calories that you're not considered at all. And so it's mind blowing. I tell people, just take a look at it, and the next time you get that Polynesian sauce from Chick-fil-A, or just
Mm.
take a look at that top there and see if it blows your mind. So I think it's like little things that we have to sort of pay attention to.
Yeah, but I really like that, the way that you put it in, that sort of like all these transformations in our lifestyle that happened, I think, in our parents' generation and continued in our generation. So with just these things that they were considered to be cool, like
Yeah.
fast food, because
Uh-huh.
it just like basically it makes life easier. You don't have time as working parents, so it's a fix. And
Mm-hmm.
then, there's drinks, the Pepsi, Cola, they were
Mm-hmm.
actually pretty cool. You just mentioned that when you
Yep.
had guests, your parents were going to
Yep.
get, and then it was just like a treat. And
Mm-hmm.
then after all these things, just, driving everywhere and,
Mm.
just like being dependent on our cars. Now we are dealing with the consequences of that. And then we
Yes.
realize, okay, first we go and try to change things, try to come up with artificial sweeteners, try
Mm-hmm.
to do diet cokes, and
Mm.
then we realize, okay, that's not a
Oh, that
fix,
didn't work.
right? Yeah. So I think we are going back to our roots now,
Yeah.
back to a healthier lifestyle, which I think it's
It's good.
it's good. It's
Yeah.
all, it took us some time, but I'm hoping that we see more and more of
Yeah.
this happening.
Yeah. And I think there's, even for better or for worse, I think even like, food industry is catching on as well because like the
Mhm.
dairy, I think was it 2020 or 2019 where the dairy sales went down. So for dairy for milks. And so you saw plant-based milks increasing. Like, okay, just small step in the right direction. And you can see now sort of this boom in all of the plant-based meals that you're starting to see, which, I try to tell my patients, actually, that's just, most of those are pretty processed as well. So we try to, get you to real food, but it's still kind of in the right direction. If it's a patient that you're trying to do meatless days, if it's, if that's an easy way for them to do one, then I think it is like awesome. But I think we're starting to see that shift because even sort of, our, commercial and, the food industry, once they start to follow, the money is there now. So I think we're slowly moving there, which is awesome for climate, for life, for health. So I think it's awesome.
Yeah, amazing. So Richa joined us. Hi, Richa.
Hi.
Yes, and Dr. Zari actually is saying, you said it. My kids dream about Polynesian sauce, and I keep being the bad mom. Too much pressure on families with corporations profiting off our health, which
Mm-hmm.
is totally true,
So true. So true.
right?
And that's so true. I mean, like I used to pressure my mom. Like I said, I think about it now and it's hilarious. I thought she was a horrible person for not getting me Lunchables because when you went on these
Right.
field trips, that was the cool thing to have.
I know, and all
Um,
other kids, they have all these unhealthy snacks, and
exactly.
yeah, it's just like there was this documentary on Netflix, which was mind-blowing. I forgot the name that shows how they basically where our food comes from.
Yeah.
Even the meat that we
Mm-hmm.
think, it's just
Yeah.
like lean and healthy.
Yeah.
It's yeah,
Yeah.
it's
I
crazy.
sent one of them to one of my patients and her son who were trying, she's like trying, they were trying to both to get there as well. And they had seen one and it's like, oh my God, I think I showed them a picture of like, what fat looks like. And I wasn't even trying to gross them out. It was just like, oh, this is what it looks like. We're gross people because we just look at the stuff all the time. We don't realize that things are gross anymore, right? And so she got interested and said, oh my God. And I sent her sort of a video to show how animals are, treated and how,
Hmm.
what these like farms look like now versus what they used to look like, when our grandparents were, my grandparents had chickens and that sort of thing. It's a far cry different from like these chicken farms now that are right next to the pig farms. And these pigs, their cortisol levels and their stress levels are increased because they stay in these tiny little areas. They're not even allowed to like, they don't have enough room to like move or
Right.
nest when they're pregnant. And I'm like, that has to have an effect on us as well because we're eating these meats that had these high
Sure.
levels of all
Right.
these cortisols that are these stress levels. I'm like, that can't be, a coincidence. So when she saw
Totally.
that video, she goes, "You really are trying to get me off of meat, huh? That was horrible." I'm like, you asked for it. Hey, who am I to deprive you of science?
Yeah, yeah, I hear you. So, is West functional training is saying I tell my clients to read the labels? I think yes, definitely. We need to teach our patients or clients
Yes,
to always be aware of whatever you put in your mouth. Check it,
yes.
check it out.
The big
Um,
things I tell them to look for, because a lot of these foods that are convenient, the sodium levels, a lot of our patients have high blood pressure, looking at that sodium level and they're freaked out. They say, oh my God, I cannot believe this had, 900. Like, oh, that is insane. I'm like, uh-huh. And it's like these things that are healthy, marketed as healthy with like beans and cauliflower rice and that sort of thing. They're all already mixed together. And I tell them it is just as easy to buy that little box of whole food beans that costs 79 cents that has like 15 grams of sodium to throw it in your pot before you go upstairs to take a shower. And you come back down and it's done. It's just as
right.
simple. And you've cut out, all of the sodium, all of this stuff. So I tell them to, they think they're supposed to be healthy. You shouldn't turn it around. There shouldn't be a list of 20 ingredients. It should be, should not be that way.
Exactly.
That means there's a
Right.
bunch of other crap in there that you can't pronounce and you shouldn't be eating it.
Exactly, right. Yes, I think the number of ingredients on the labels are inversely related to the
Yes,
quality of
for
the food,
sure.
for sure. So yes, Sarah, that was the name of the show on Netflix, Game Changers. Yes,
Ah,
thanks
okay. I need
for
to watch that
mentioning.
one.
Yes,
Okay.
yeah, thanks for mentioning that. And Sarah is saying we just have to be careful because these food companies have billions to use massive psychological
Oh
tactics
yeah.
to convince people to consume their food. And
Mm-hmm.
that's amazing. So, I'm doing my life coaching school training. I'm Brooke Castillo. I don't know if you know her.
Oh,
She's just
awesome.
this big life coach, and she started with being a weight loss coach, and she has actually a lot of great ideas. And she was saying that basically all these companies and all these our environments, basically they're selling us concentrated pleasure. So it's
Mm-hmm.
a lot of, sort of like psychologic
Oh yeah.
tactics, as Sarah brought up, going on that basically they concentrate all sugar and they
Mm-hmm.
sell it to us. And then we develop this urge to
Addiction.
have that.
Yeah.
Exactly. That's addictive. Sugar is addictive. And also, that's going to affect our hormonal
Mm-hmm.
balance and
Mm-hmm.
insulin surge, and it's going to make us more and more hungry.
Yes. And I talk to patients as well. And it's nice when they kind of get to that point where they're actually able to pay more attention to it, because I also let them, I say, think about when you eat an apple versus a bag of chips. You can sit on the sofa, and if you're not paying attention, you can eat an entire bag or entire sleeve of Oreos or something, and you're still technically hungry. It's because your brain isn't monitoring, isn't
Mhm.
seeing that as an actual nutrient. Your brain, you were probably
Exactly.
hungry before you started that, but those are just, they're literally empty. They have no nutrient value in them. And so that's why you can continue eating this, because you've not gotten a nutrient value. And so that's Oreo's winning in that situation because you've eaten an entire sleeve. You're
Yeah,
going to buy another sleeve of that, right? But as it is, how many apples can you sit and eat in a setting? Probably not a lot, because that
not
fiber in there is going to
right.
turn off that ghrelin, because it's gotten a nutrient that is hitting the signal in your brain
Hmm.
that says, I am full. I can turn this ghrelin off. I don't need any more food. I am satiated now. I've stretched those receptors. I feel great. So that part is pretty cool. When they start to notice, they're like, oh my God, you're right. I don't feel hungry. So I'm not reaching for snacks now, because instead of, grabbing something on the way home, I have my apple in the car. So I'm driving home from work. When I get home, I'm not dying. So I'm not grabbing everything in the kitchen while I'm cooking. So it's just like finding those little tricks, and when people are eating these snacks and that sort of thing, and sort of switching them out. And when they start to
Mm.
recognize that psychological piece, it's really cool to see. My mom was advertising executive. So she's like, oh yeah, that's clearly our jobs, is to make things like those little jingles that they're in your head. They like subconsciously make you want that
Right.
thing that you keep singing in these commercials. And that's somebody's job, to be to understand the psychology of what colors are going to appeal to what person. And they do a great job of marketing to us
Right.
and kids, sadly.
Yeah, they're after a brief dopamine surge, right?
Mm-hmm.
It's just like what they're making money off of.
Mm-hmm.
And I see Risha is saying, I used to be a zebra cakes girl in high school. My mom let me because I asked.
I used to want those so bad. I was jealous of you, let me tell you, because I wanted those. And I guess the good thing is that I that my mom is, because now I don't crave those things, and I like the idea of them. Like, oh, it's horrible, but I wanted them so bad growing up. I wanted like all those little Debbie cakes. I thought they were like the
I,
coolest thing. I thought the kids that had them were so cool, and I thought my mom was
I
just
know.
lame.
I know, right? That's amazing. So East West functional training saying sugar craving triggers dopamine, right?
Mm-hmm.
Exactly. And Dono is saying my mom only drinks diet soda and coffee.
Oh no.
I think your coffee is thick. Coffee is actually pretty good.
Yeah, coffee's
It,
fine. It's what you're putting in that coffee is usually
I
the
know,
issue.
but
How
not
many Splendas and,
right,
sweet and low, and how much milk or in half and half creamer are you putting in there? Milk, but you can't live without my coffee though.
Okay, so I just move on right now.
Okay.
I just want to move on to this second question now. Just let us know how obesity affects our gut health, Janice.
Let's see. So obesity, you have these hormonal cells. You have leptin, you have ghrelin, you have adiponectin, and adiponectin is comes from sort of your fat cells, and you have this inverse relationship, and that sometimes you can have kind of pro-inflammatory sort of um, you can have pro-inflammation from these kind of excess fat cells. And
Mm-hmm.
so these are problems. And so sometimes you can also have what's called a leptin resistance. And so leptin usually is the hormone that sort of gets sort of anti-obesity, like not obesogenic, right? So it helps you with satiety and not feeling hungry. And so it's sort of just like insulin resistance, in which it's because it's related to how much fat cell mass you have as well. So with leptin, you can have this increased level of leptin, but it sort of gets to the point where it sort of just burns itself out in the sense, sort of just like insulin and diabetes. But there's so much insulin that keeps trying to go out to attack all of this glucose. Kind of the same thing is happening with leptin. And so the problem becomes that you have this leptin resistance. So that's sort of one kind of the hormonal piece that happens with that sort of as well. And so so it's this inflammation, it's this hormonal piece, and it's sort of over this lever. And then you also get to a point where people will notice sort of this issue with sort of this theory is called the set point theory. So patients will come to me and they're really fed up at this point because they have tried to lose weight. They get to a point and then they plateau and they're not able to lose anymore because they're doing the same thing, but now they're upset because they can't lose anymore, but now they're more
Sure.
hungry. And now they feel like, oh my God, I'm a failure because I want to eat more. What's wrong
Mm-hmm.
with me? And then they just give up, which is why kind of maintenance visits are so important and follow up. But what happens with that, and I talk to patients about, is your basal metabolic rate goes down. So it's another thing that your body sort of it kind of plays against you. So the amount that you were typically doing in order to get that weight off, your basal metabolic rate has now decreased. So you have to get even further below that caloric to be even more calorie deficient in order to continue to lose weight. And also your ghrelin and leptin levels change too. So sadly enough, your ghrelin levels increase when you lose weight,
Mm,
and that's your
yeah.
hunger hormone. And so I warn people about this in the beginning. I say, this is going to happen. It is not you. This is called obesity physiology, which you cannot change. Our goal is to sort of get you over that. That's my job, is to know tricks and different tools to pull out and know when that's going to happen so you don't get frustrated and to keep you kind of on your path. And so those are things that we sort of talk about a lot with the sort of the
Mm-hmm.
set point theory. When I think that was, we were trying to think about, so why does this happen? That's so mean. Why would your body do this to you? But if you think about back into like hunter-gatherer days, we weren't eating these full meals 3 times a day. And so if there were periods of time in which you weren't eating, your body's, a natural mechanism is for you to be able to say, oh no, I can't let this person die. I have to decrease my basal metabolic rate so we can maintain their weight. And so I tell patients that your body is really trying to save you in a sense. But even though you're trying to get more weight off. So it's sort of a bunch of different like hormonal and genetic microbiome and sort of this leptin. There's a bunch of different mechanisms that kind of are at play when patients have that excess weight. So I tell people it's very complicated. It's not just one thing. It's not just, the old thought of like food in and energy out. It's far more than that. It's the
Sure.
environment. It's the types of food that you're putting in. It's the sleep. It's the medications you're taking. It's the other medical problems you may have had. It is sort of the stress level, your fitness level. It's everything under the sun. So there's so many other factors that really, really impact sort of that excess weight and having to get to the bottom of all of it. If you're not sleeping well, if you're super stressed out, those are things that are going to not be helpful. Patients that work shift work, like you'll notice in shift workers, they tend to have excess weight as well. And it's much harder for them to lose weight because of these odd hours and difficulty in sleep patterns. So there's just so many things that you have to sort of overcome. To help patients in that because it's becomes super complex.
Right. So, we are living in an obesogenic environment, right? It's
Exactly.
everything is pushing us towards that increase in our adipose tissue. So
Yes.
you nicely brought that up from the sleep, lack of sleep, from just the amount of work from stress. Stress by
Mm-hmm.
itself is just an obesogenic. It
Yeah.
just affects our hormone and pushes our metabolism to a certain way that we store fat
Mm-hmm.
rather than just to expend fat,
Yeah.
to spend and burn fat. So it's amazing. So I think as a obesity medicine doctor or a weight loss specialist, you need a lot. You need sort of like a lot of information. You need to work on different aspects of a
Mm-hmm.
person's life as a
Yeah.
whole.
Exactly. And
Hmm.
part of my intake form includes literally all of that. So we can kind of, attack it piece by piece. People are like, why are you asking me how much I sleep? Like, because there's studies that show patients that sleep less than
Hmm.
6 hours or greater than 10 hours, you need to be in that sweet spot of 7 to 8 hours. And so patients that are above or below, like there's studies that show that these people have a more difficult time with sleep. I mean, with weight
Hmm.
loss. So these are all so many things that's so nice to be able to sort of point out and show them, I had a patient that was starting, she works a full-time job, has 3 children, and decided that she was also going to get her master's on top of that and said, it'll be fine. I can do the full load. I'm like, why are you doing this to me? She goes, to you. I'm like, yes, it's doing this to me. I said, just pay attention to how you're feeling, how you're doing. And within 2 weeks, she goes, I gained 3 pounds when I had that full load. And she goes, you know what? I said, oh, she's right. She's so annoying. And dropped one of those classes and promptly lost 4 pounds. So it's so fun when they start to, even though you're like that nagging mom annoying them, they sort of hear you and they're in the back of their heads and they're doing certain things. And she's like, okay, fine, you're right. That was stressful. And I saw the stress. I didn't feel the stress necessarily because I'm used to just handling things, especially women. Women are just used to trying to do it all. But yeah,
Yeah.
when you start to notice, oh, on the scale, my body doesn't really like this too much. So
Right. Yeah, exactly. So I want to move on, just going
yeah.
back just to where we started about gut, the chicken and egg, the way that our gut health affects our obesity, a gut that is not healthy is an obesogenic environment
Hmm.
for promoting weight gain and obesity. On the other side, so we see that in patients who have obesity, they're at very high risk for certain digestive issues, very serious issues such as colon cancer,
Hmm.
because as you mentioned, obesity basically causes an inflammatory state in our
Hmm.
colon, in the lining of our
Yeah.
colonic cells, the lining of our colon, that basically causes this inflammatory status that can promote development of cancer. Or we see that obese patients basically suffer from constipation, this motility, more of motility
Heartburn.
issues,
Hmm.
or gastroparesis, or I don't know if there's anything else that you can think of. What other conditions?
Heartburn, chronic abdominal pain,
Exactly.
bloating, nausea,
Right.
the fatty liver we talked about, heartburn leading to esophagitis or leading to Barrett's, esophagus. Barrett's esophagus is a
Hmm.
precursor for esophageal cancer. Um, let's see. You see diarrhea or constipation, people needing, having, increased risk of colon polyps due to increased
Hmm.
red meats and processed meats. These polyps lead to cancer.
Yeah.
Yeah, so the list really
So
goes on
almost
and on.
everything, right?
Yeah.
Almost all GI
Yes.
pathology.
Oh yeah.
So, yeah, so we have only 15 minutes left. So I wanted
Wow.
to have you also briefly touch on the role of exercise.
Ooh,
Yes, in
that's a
gut
good one.
health, in weight loss. Yes.
So that's a good one. And we talk about that a lot with patients. Because I tell a lot of patients you can't outrun a diet, right? And so, well, a bad diet. And so we talk about that a lot because patients will think, oh, I can just go work out for an hour and I can still, eat this entire dozen of donuts or whatever. And so we talk about actually the science behind it. And so I think the study was in 2018, maybe 2018, I think, that showed that just for general health, we need at least 150 to 300 minutes of exercise with moderate
Hmm.
activity a week. And at the time when I was sort of reading this, I had gotten into Orange Theory, back in the day before the world was, like where we are now. I haven't been in forever now. Thank you, COVID. And so you use this monitor to kind of show what your heart rate is, and everybody looks at it on the screen. And so what kind of moderate activity in Orange Theory is in green. So like a heart rate, so your range like 85% of sort of your baseline. And so I
Hmm.
thought about that when I was sort of learning about this. I said, wow, that is like pretty intense. The average person is not doing 150 to 300 minutes of exercise at that intensity, per week. That's a lot. So that's, and so that was just for general health. That's just for, general health. And so to prevent weight regain, the study showed that you needed up to 420 minutes a week of like
Mm-hmm.
this kind of high intensity sort of workouts. And so that sort of kind of changed my kind of how I talk to patients about kind of exercise, because you're not going to have a person whose BMI is like 50 go out to the door and be able to do 420
Right.
minutes a
Yeah.
week of moderate intensity to high intensity exercise. It's just not happening. And so, I talk to patients about kind of exercise being super important for overall general health. And then it's also super important for maintaining weight. So once you've lost the weight, it's really important for maintaining weight.
Important.
So about 300 minutes a week of sort of moderate, like 300 to 400 minutes a week of moderate activity. And so that all definitely changes your microbiome and changes sort of the endorphins we talked about earlier. People get these serotonin sort of highs, and like it's like taking an antidepressant when you go for a run. Um, and so we sort of talk about that a lot, and about sort of what that entails. And so, patients will do, 30 minutes a day, like 3 days a week. And they're like, oh, but look, I did like, these 30 minutes. I should be losing weight. And so we talk about kind of changing their sort of mindset around sort of how much exercise they're doing and sort of what that sort of equates to. And I get them to sort of, I kind of break down those thermodynamics and like the body of sort of how they're burning, these calories, and sort of how that breaks down with their basal metabolic rate. And I use a fancy machine in the office to kind of show them that part, but also to show them sort of how much exercise works out and what their body works out. And so it's sort of really cool to be able to show that, exercise is just a small piece of it for loss, you know what I mean? But it's very important for bone health, very important for joint health, very, very important for your functioning overall, and for mental clarity, but also definitely for weight maintenance. So that's a big one for patients to sort of get over to, and thinking about sort of, not having to do as much on the diet and the nutrition end of it, because they've
Mm,
worked out sort of 3 times a week. Especially now, so people that are definitely even more sedentary than we were before, because most people are working from home. We still have to go in, but most people are, they go from their bed to their kitchen table, which is their new office now. They're not having to even walk around the office or walk to their car to get to work, or take the subway to get to work anymore. So I talk to them a lot about how drastic things have changed. So the 30 minutes 3 times a week you are doing, you really have to amp that up, because you're not moving hardly at all. And I get patients to look at that. They think, oh my God, you're right. I looked at sort of how much I was walking, and I had like 500 steps. Like it was, I was like doing nothing. And it was easy to get these steps in before, because you're going to work, before downstairs in the office, and just like random errands that we run. But now there are no errands, because things are closed, and
right.
you're at home. So things are, markedly different. So trying to include like that daily walk-in, including sort of the activity, and trying to ramp it up a bit, it becomes really, really important.
Exactly. Janice, what I tell my patients usually is that, as you mentioned, exercise is really important and key for overall health, for our overall health. But it's not a great tool for weight loss. It's a very good tool to maintain your weight. So, because a lot of, as you said, a lot of patients who come and they're obese. So basically, what the issue is that they have some limitation, in order to start an
Mm-hmm.
exercise program, or at least an
Yeah.
intense exercise program.
Mm-hmm.
So I think you have to get them to a point that they're more comfortable with their body, and they can just like basically just get engaged into moderate to high
Exactly.
intensity workout. And I think it's very important to just communicate that with patients, because they don't know really.
Mm-hmm.
There are a lot of the misinformation out there that
Oh,
you can just lose weight with just an exercise
yeah,
program, which is
exactly.
not the fact, right?
No, not a fact at all. Yeah, and it's also nice to, set their expectation for them to ease their ways in too, because people, a lot of patients, they're so sick of it by the time they say they want to do an overhaul, they want to do everything overnight. I had to like slow them down and say, no, 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 like, we want these to become habit, and I don't want you to kind of feel like you're missing things and you're craving things and you feel deprived, because then you just quit. And you're not going to go run a marathon tomorrow. I want you to start with one thing a week. I want to get rid of sodas first. I want to start with increasing your water intake first. I want to start with breakfast for the first couple of weeks. Let's just start, slowly. And then when patient starts to lose weight, one patient said he thought his scale was, he goes, no way in the world with just changing one meal I've lost as much weight. But it's so fun because then they have more energy all of a sudden. And then he
Right.
goes, now I'm
Yeah.
walking to the grocery store and I don't have joint pain anymore. My PCP is
Exactly.
excited now because I'm able to get off of one of my blood pressure medicines. Like, this is exciting. So, once they start to see those small things, then you can incorporate, okay, I want you to walk a couple of times a week now.
Exactly.
If for
Just start
15
with
minutes, don't go
walking.
crazy.
Yeah.
Don't go crazy.
Right.
15 minutes is good. You go from 0 to
Just
15
small
minutes. That's
goals.
great.
Right. Yeah.
Exactly.
Setting small, but I think practical goals, right?
Exactly.
That are easily doable. Amazing. So great. I have a lot of questions, but we are just
Uh-oh.
getting close
Okay.
to yes, it's my time is
You're right. 8:21.
7:20 and your
Yeah.
times is 8:20.
8:21. All right. Rapid
So
fire.
yes, no, I just no rush, but I wanted to use your brain and see how you see the future of obesity medicine.
I think the future is bright. I'm excited about it. Actually, a colleague of mine from a nutrition fellowship, she's at Cornell, and she's also GI. We decided, like the reason we did this program was because people didn't have this access to this information. So we're starting curriculum for nutrition, curriculum for GI fellows, and so trying to kind of test that out to see how that works. And so I'm excited. I think, people are starting to be excited more about it. People are starting to recognize the importance. I did a grand round talk and people were super excited about sort of bariatric endoscopy. A lot of patients, a lot of, people hadn't heard of them. Like, what are you talking about? You suture the stomach? What are you, crazy? So I think the more people start to learn about it, the cooler, it seems, and sort
Mhm.
of, taking away the stigma of the anti-obesity medications. And I tell patients, I talk to doctors, I'm like, if somebody came in with a blood pressure of 180 over 100, you wouldn't send them home and say, lose weight. You give them medicine, they have an
Right.
A1C of 10, you treat it. So what's the difference? Because bias is in there. So why you think there's a difference. It's a bias of why you don't want to get in this, anti-obesity weight loss medication. I think we're slowly changing the bias. We're slowly kind of catching patients younger. I've had, college students and med students reach out and residents, about interest in nutrition and how to get more, where to start. And so I think with obesity medicine courses cropping up and lifestyle medicine courses that are all sort of on the same page and wavelength, I think, and we're going to try to push this nutrition curriculum more as well. I think it's catching on and people are starting to recognize, okay, this is cooler. Isn't fake. It isn't like,
Mhm.
tree hugger science. And, it is a little bit more to it than, than just, go have water and don't eat as much. So I think that's the future. And I think it's, more patients, more people will get trained. And, there'll be more physicians are that are focused on this and aren't so biased when it comes to seeing these patients and aren't blaming and accusing. So I think the future is I think it's coming.
Yeah, I think future is bright, right?
Yes.
It's yes, exciting, fabulous. It was amazing. So Janice, tell our audience where they can find you.
Oh, yes. It's Gut Theory in Washington, D.C. Downtown and conveniently located in DuPont. You can get there from the DuPont State Metro Station, 1712 N Street, Northwest in Suite 101. And you can find me online at www.guttheoryhealth.com. Book an appointment, check us out. First appointment, we do it by telehealth, so you don't have to, come downtown. You can do it from the comfort of your home. Super
Nice.
easy. If you just want to chat a little bit and give us a call, you can give us a call at 888-755-GUT1. And if you have any questions.
Awesome. I love the name Gut Theory. How did you come up
Thanks.
with that name?
It was, I was like trying to kind of find a play on words. I didn't want to use my name of like, sort of the fact that it was sort of evidence-based and this sort of a theory behind how this all should work and play
Hmm.
together. And then it kind of just, I was like trying to find ways to put gut in there. It's like, it all starts with the gut. joke with my cardiology friends, like the heart is only there to kind of pump blood to the gut. We're more important. And so I was just trying to find a play on words for the gut. And it just kind of came, one of my best friends who is a graphic designer and creative artist was like, what about, we kind of kept playing with the word gut and finally both came with the gut theory. Then with the total digestive care was something I came up to add to the end of it because it was sort of, I wanted to say that's including everything. So kind
Mm-hmm.
of finally came up with it. And then I
So I
liked it.
think, yeah, there is something with the word gut. I see some gastroenterologists in the crowd. So I don't know. It's just like I love the word gut. And my husband is not in medicine, and he says, "Oh, this is disgusting gut." But what's about gut? Because I love this. My sort of like brand name is Mind Gut Fit MD, and I always wanted that gut in the name.
Exactly.
Our series, we called it Fit Gut Advanced.
Exactly.
Sorry, somebody was calling me.
Somebody
Uh,
called me too. I was like, go away.
I know. So I don't know. There is something about the word gut. I think it
Yeah.
attracts sort of like gastroenterologists.
Oh yeah. That's our thing.
Yeah, it's our thing. It's just like this
This
poop
poop
cough.
emoji. Yeah. That was my first gift when I matched into GI. One of my favorite chief fellows gave me a little poop emoji I wear on my white coat, and it gets a laugh out of patients. So it's so cute. And I like my first poop emoji. I love
Mhm.
it.
Yep. Janice, thank you. Thank you very
Thank
much.
you.
It was an amazing talk. So it was very informative. I'm hoping we can continue that.
Yes.
So this is our last day. Obviously, Vanny and Christina are going to hop on briefly. They're going to do this exciting culinary experience live. So tune in, stay on. But before we wrap up, I wanted to take a few minutes and thank everybody, our speakers. So taking time out of their busy schedules and just taking part in this series. So we started last week. We started with more like general topics, and then we niched down as we got to the second week. We had amazing discussions, and we had fabulous speakers. I want to thank everybody. We started,
So good.
yes, last week we had Real Dr. Ugo, we had Aline Sharbati, we
Yes.
had Dr. B.
Hmm.
So I'm trying to not miss anybody. We had Vanessa. Vanessa is here. Thank
Yes.
you very much. We had Joanna Gastro, Doc MD. We Yesterday I had Andrea Hardy.
Yes.
She's a registered dietitian from Canada. Very great talk. Who else did we have? I'm hoping I didn't miss
What am I?
anybody. Supriya came on
Yes.
yesterday with Christina. They talked about supplements.
Yes,
I
that's a
think
big one.
I'm missing,
What
I
am I
think, one
missing? I'm
person.
thinking too. Yeah.
Oh, we
Um,
had Windy City, gluten-free Windy City.
yes.
Yes, the we had an amazing talk and discussion around celiac. Right. So it was great. So what we are trying to figure out is how we move on from here. So we would love to continue this. So we are
Yes.
trying to figure out how we can just continue more like a persistent, just like educational videos and IG lives. So stay tuned. We are going to come up with something exciting very soon.
Awesome. Awesome.
Okay.
Thank
Yeah,
you so
thank you
much for
very
having me.
much. Yes,
Have a
thanks
good one.
everybody.
Bye,
Thank you.
guys. Bye bye.
Bye. Bye.